Hallo vir julle wat al klaar op die show is. Goeienaand.
Ja, goeienaand,
Ons
Matas.
kan julle sing, Susan, Sean, SA Bros, Cindy.
Cindy, hallo Nicky.
Right, let's
Sean
go live.
Tucker, let's go live. Oh. When you are feeling blue and you run out of things to do, just remember you're not alone. I know these two guys that are home alone. Two guys with the greatest guests, entertainment at its best. Grab your coffee, grab your crisps. It's the YT and Chris Show, SA Bros. Yeah.
Yes, yes. Yes, goeienaand man.
Wat sê jy, man?
Chris, lekker en jy Bram, maar voordat ons aan gaan sit asseblief daai closed caption nonsens af dat dit weer opgekom en ek sien dit kan
Okay, maar ek werk baie gou daaraan.
That's say. So good evening everybody. Welcome to Monday night here on SA Bros. We've got a special first timer tonight. We've got a repeat guest.
Yes, we do.
We haven't had that yet.
Yeah, but this is very important, yeah.
Yes, this is a very important one. So let's just go quickly through everybody. Nicky, Susan, Christu, Lizzie, Fran. Hello, Amal. Good evening, everybody. Guys, tonight is not our normal SA Bros malfucking show. We're talking a serious show tonight. As you all have seen in the news, the heavy spike and the increase in the COVID-19 coronavirus statistics and new patients and so on. So Dr. Nicky Reins is back to chat to us about this. And guys, have your questions ready. We're not going to, Chris and myself aren't going to speak too much. We've got questions for her and so on from you guys. So please, let's listen to Dr. Nicky Reins. Let's listen seriously, guys, because this shit is going to help us decide and make the president's decision easier, that if we're not going to listen to the rules, shit's going to happen. And the rumor is floating around that we might go back to level 5. Let's all work together not to go back to level 5. Want anders te kak alles.
Ja, dan die lands klaar in sy moer, maar dan sy eers in sy moer. So we're going to do our best to, listen to what she's got to say. She is going to give us a load of important information about how to look after ourselves, what we can do to just boost our immune systems and stuff, not just for COVID, but for everything that's coming this winter. So
the questions are already rolling in, so let's say hello. How's it, Nicky? How are you? And welcome back to the SA Bro Show. We've got a black screen. Right.
Hold on. Hold on, net weer af, het sit er weer op.
Niks. Oh, daar kak alles.
Ja, kak alles. En ek kan haar sien, nou is sy weg, heeltemal weg.
Ja, gone.
Ons gaan nou opkry. Dude, interesting ding is, soos, okay, ons weet alles spike nou, en ek weet almal wat nou hierna kyk, gaan saam met ons het baie fucking vir hom te vra oor vanaand hou.
Ja, en ek wil net gou vir Jock antwoord, Jock Brown. Ons sit by die huis, my vriend, my huis, en Chris sit by sy huis, ons hoef nie maskers te dra nie. Ons dra maskers as ons buite toe gaan.
Ja.
So daar sê.
Man.
Ek wonder.
Goeienaand Takbok, ek net vir hom hallo sê fucking, want hy het nie so Takbok word nie gegroet nie, ou maat.
Jean Botha, hallo Takbok.
Ja, alweer.
Michelle Stewart, hello julle, Roxanne.
I just want someone to tell
me.
It's safe that I've sent my child back to school and I'm so stressed. Well, you know what the cool thing is that kids' immune systems are pretty amazing, although it is still dangerous. Man, if they take the right precautions and if you've actually taught your kids how to kind of look after themselves with the social distancing and everything, they should be quite fine, Cindy.
Ek gaan nou gebel, jy het die, né?
I got this, my brother. Yeah. So, daar sê. Oh, okay, ek gaan nou hier so deur alles. Let's go, kindergarten. How's it guys? Hello top dogs. Away my second. It's lekker checking you guys here. Oom Dani, goeienaand, lekker. So guys, tonight we've got a medical professional to actually talk to us and tell us what the hell is going on. Whether the government has sorted out the hospitals and stuff. We don't want to talk politics with her, but we'd love to know what the numbers and stuff are and what her predictions are, because she represents the whole medical field when she talks to us. Although we can't put her on the spot like that, she's the closest thing we've got to an honest answer. And ek het gecheck ook my seun wat op die skepe was is ook hier. So let me carry on saying hello to everybody here. Roanne Jacobs Anderson, hello. Susan Mossekind, Michelle Stewart, hi guys. Candace Taylor, Jean Botha, Jock Brown, Liz Angel. Let's see who is there. Hello Angel, Angelique Angel Botha. In Wainscotta, goeienaand. Guys, we're just sorting out Mrs. Rains' stuff so we can get her back on. She is going to be with us just now. We gaan ons actually lekker chat met haar. Daar is so baie nuwe stuff waarmee ons nou besig is. En ons het vir julle ouens moerse cool stuff waar ons wil praat. Oor 2 weke, ons sou nou hierdie naweek gegaan het na St. Lucia toe. Dan gaan ons vir julle 'n lekker informative show doen oor diepsee visvang en oor die amazing plek met die naam Marlin Lodge in St. Lucia of in die Isimangalisa Wetland Park is net daar om die hoek. My persoonlike pelle, moerse nice dudes. So ons gaan vir julle 'n helse interesting show hê van daar af. Meeste van die stuff gaan pre-recorded wees. Ons gaan kyk of ons daai Vrydag live kan gaan met julle. Maar ek en Whitey is besig met ander goeters. Ons het baie interessante stuff. Omdat daar nie meer so baie celebrities is nie. Al die ouens raak besig. So we have started planning a different kind of show for you guys. A bit more informative, a bit more brosy, if you know what I mean. But we are also going to do cheeky stuff. So me and Whitey are going to go for a manicure and stuff. So the girls here can also experience and show people what that stuff's about. And we'll do interviews and stuff there. What's news on the shirt, Cindy? I know we will be able to let you know as soon as we know. I'm sure Whitey spoke to Paul today, so we will know as soon as Whitey's back on the show. I'm sure he can tell us something about that. Ja, John, ek dink baie, kom ons gooi hom ophou. Ek dink almal het kak baie vrae oor hierdie topic, so well done. Mense is confused as hell. John, ek kan nie meer saam met jou stem nie, dude. Op die oomblik fucking is die land nou in rep en roer. Alhoewel ons die land is met die langste lockdown uit almal uit. Ons het geweet die ding gaan spike, maar nie almal het gedink het gaan gebeur met hulle nie. So vir daai ouens wat fucking gelag het vir die lockdown en terwyl ons almal gesit en sonder werk sit en fucking by die huis sit en stress en worry, hopelik so daai ding baie fucking ouens uit wat vir ons almal die lewe moeilik maak. So ek hoor het om dit te sê, maar dis regtig hoe ek voel, man. Is glad nie cool nie, ou. Dat daar so baie poepole is wat fucking almal se lewens in gevaar stel. Ons het juist met 'n bra gepraat wat daar van die skip afgekom het. Hy is hierso, ek weet hy luister vanaand. En hy het ook saam met ons ou Christo Delarey, maar se kinders. I told you guys, dude, fucking, ja. Hoeveel maande is dit nou verder? Is jy terug, Whitey?
Ja, ek is terug. Ek het nou vir haar gesê sy moet net op haar selfoon klim op die 4G en haar dinges, want haar dinges nou het heeltemal gecrash daar. So. Die arme vrou het nie gelag met haar connection as sy met ons praat nie.
Ja, ek seker sy is beter met mense.
Ja, sy is 'n dokter, sy is nie 'n technician nie.
Hoorie, ons het 'n bed gehad met Christo.
Hang aan.
Ja.
Nicky?
Ja. Wat ek hier so vir almal, al die ander mense terwyl daai bra besig is, maar dan kan ons almal net weer saam gaan kuier, dit maak mense dood hoor. Hoorie, ek seker weet jy wat is net so groot killer in hierdie tyd is die fucking stres waardeur almal gaan. Ouens wat nie weet nie, wat worry and shit. We must trust my SA bros, absolutely Troy, little Troy Lowry, and that's true words my brother. Listen to your mother, wash your hands all the time, and fucking bly net skoon. Het is so maklik om dit nie te kry nie, dis 'n typical griep flu ding. So and everybody's doing the right thing to try and sort that out. I'm sure Watty is going to sort. He's going to sort everything out now. Let me sit and chat with you guys. So, tell me, what have you guys been doing this weekend? I managed to get my ass into the Oosrand. Ek was teruggaan na die motherland toe. And I got fraught with another bra of mine. And we got very gekuierd. En gister was ek amper fucking dood, Watty.
Check your private chat code.
Okay. Ek was amper freaking dood. Ek is hier op private chat, ek kyk nou. Maar ek was Sondag was die heavieste babbelas wat ek in my lewe gehad het. Ek het nie besef omdat ek soveel minder suip, is dit soveel moeiliker hou.
Ja, dit is moeilik hoor.
Ek my lewer hanteer nie meer dop soos wat dit altyd het nie.
Ja, exactly. Hoorie, ja, check dit daar wat ek vir jou gesê het.
Ja, jy kom my net gesê het.
Ja,
maar
ons is maar so. Okay, hier gaan ons. Ons kyk.
Ja, ek het nie my bril nie, dus kom ek so sukkel om te lees.
Nicky.
Hi, Nicky.
Yeah. And look at that.
Are we just going to do this? Okay.
Yeah. And just turn it sideways and put it against your laptop. There you go.
We can do that.
There you go.
Yes. What's up, Doc?
Yes. I'm going to think you guys don't want me on this show.
It's not us, I promise you. Yes, man.
But look how stable the connection is now.
But now I'm going to try. How many times can you let me into the studio? Because I've got my computer going as well.
There, you're in somewhere twice now. But let's stick to the cell phone, Nicky. The connection is better and the quality is better.
Yeah, absolutely.
Okay.
Yeah. Oh, so hi, Nicky. How have you been since we last seen you?
Ach nee.
Wait.
Ek sing.
Ching.
Ag sorry.
Nicky.
Yes.
And now this time your cell phone crashed. Ooh, and
Yeah. Okay, so I don't know which one you want to use. Choose.
Oh, okay, there you're back on the phone again. That's working
Which
now.
one do you want to use?
We'll sort it out, don't worry.
There we go. And then unmute yourself.
Yes, okay. Yeah, there's
I'm not
Nicky.
muted.
No,
There you go. Now you're back.
You're back. It's perfect.
Okay.
Yeah.
Are we good? Okay.
We are good. Yes. Okay, once again, how have you been since we last seen you?
Super.
It's been a while.
It's hectic. It's madhouse. Are you there?
Yeah,
Yeah.
yes. Sorry, Nix. We're gonna
no.
leave you. We're gonna give you a lot of time
Okay.
in between so you can speak, and then because I know there's a delay and everything, but we'll work around it. Obviously, we haven't
Super.
seen you for quite
Okay.
some time, and maybe you can tell us why everything is so hectic at the moment. Because we know
Why is
there's
it falling apart? Yeah.
there's a sudden rise in everything. So please inform us.
I wouldn't say it's falling apart. I think it's just that we are concerned and gravely concerned. I think because it always felt a bit removed. You know, you saw it on the news and you saw it overseas, and then you heard it was here, but it was in KZN. And
Yeah.
then you heard it was in Gauteng.
Yeah.
And now you are hearing that it's somebody you know. So now it's really hitting home for people.
Yeah. Okay. And do you reckon there's any reason why it's had such a big spike? Like I think I heard today that they said there was extra 8,500 new cases where
That's
we
just
used
today.
to be only a couple of hundred here and there, and now suddenly it's thousands per day. Is it just because it's multiplying or that quickly, or what?
So it will be an exponential curve as people start to become ill. And I think people felt that they could rest on their laurels, and once the lockdown was, the restrictions were lifted, people thought, well, that's it, we're safe. And if anything, that was probably when they needed to behave most responsibly.
Yeah. And we know for a fact that that's not what people have been doing. A lot of people haven't been behaving. We know that for a fact. Now, Nicky, you phoned me and you said you wanted to come on in a chat. What can you tell us before we dive into everybody's questions that's on the
Yeah.
show? What can you tell us? What do we need to do? What should we know? What should we prepare for?
I think so. Firstly, I think just what I've said already. Know that now's the time that you need to behave best. Now's the
Yeah.
time you really shouldn't be having parties or functions. Try and limit your exposure as much as possible, and be responsible in terms of going for testing. Some people are expecting to be tested just on the basis of having had a close contact. Sometimes that close contact is not really a true, by true definition. And what they're doing in doing that is that they're delaying the testing for the people who really need it, the people who are really ill. So we've gone from a situation where we were getting results back within 24 hours, without an absolute commitment from the lab. In all fairness, they always committed only to a 48-hour turnaround. But we were quite spoiled initially, and we were getting results back within 24 hours. And now it's been pushed out to 96 hours.
Yeah.
So there's got to be some responsibility and some holding back on testing, and testing really only when it's indicated.
Okay.
You know, I saw on Joe Rogan's interview that they've got 3 different tests in the States. The one's like a finger prick, and the other one's a blood test, and obviously the nasal swab that they do. Which test are we using at the moment? Is it just whatever we got?
At the moment, the only approved test in our country is a swab. The best way to swab is, well, it's a PCR test. It's a viral DNA test. And it's tested by taking a sample either most responsibly or most effectively right from the back of the nasopharynx. So it's a long, thin, flexible tube that they put in through the nose, angle it backwards, not upwards, it goes backwards. They've got a technique that they use.
Yeah.
And it goes right back to the back of the throat, and that's where they should be getting a good sample. But if they can't get in there, either because they don't have the swabs, or because the patient's anatomy doesn't allow for it, then they can do a mid-nasal swab or an oral swab. So when I say oral swab, it's not oral, it's pharyngeal, so it's still at the back of the throat.
Yeah. One of my friends had it done the other day, and he said it wasn't fun when that swab went all the way back to the back of his throat through the nose.
No, that's why you only know if you really need to go and have the test. It's not a novelty. Don't put yourself through it unless you have true indication to do so.
Yeah.
Now, Nicky, I saw a question a little bit earlier. I'm not going to go look for it now. One of our listeners, Cindy, asked. She said she sent her child back to school, and she's now super worried that is it a good thing or is it a bad thing? Is the child safe or not?
So there's a very good, in fact, I'm going to refer all listeners to a very nice information site. It's a group of the Gauteng general practitioners who have collaborated together. Firstly, we collaborated on a music, a song that we put together. But now we've got our heads together, and we've got a lot of information on a Facebook page called GGPC. There's a very nice link. One of the doctors has written on there, Dr. Israel's written all about sending children back, and you'll read how in medicine everything we do is about risk and benefit. And the benefit always has to outweigh the risk, and it's got to be individualized. So the lady who asked that question should be asking, what are the benefits? Obviously, the benefit is in terms of the education, the child's emotional state, sometimes even the parents' emotional status, because it's hard to be homeschooling. But it's got to outweigh the risk. So the risk with having him there is he going to be bringing the virus back
Yeah. Well,
So you've
Nikki,
got
I know we're having a bit of
ask
problems
who
getting.
is at home. If there are elderly people at home with significant chronic conditions,
We're struggling.
it is something
Yeah.
to bear in
Yeah.
mind.
Nikki, at the moment we're suffering to hear you.
But
There's a really bad connection.
it's not an absolute non-option.
Yeah.
They are well protected. The schools are taking
There we go.
Yeah.
precautions.
Yeah.
What else can I say? And children don't get ill. So they really don't.
Okay. Ek het nou gehoor ons praat het nou eers deur gegaan na toe.
Ja, ek
So,
weet.
Nick, we're just going to try and sort something out so we can get back to you.
Are we delayed again?
Yeah, don't worry. Whitey's going to phone you back quickly. I'm going to run through all this stuff and actually chat to the guys and see what they have got to say about this. Because no saam met jou, Whitey. Right, I have to travel to Mafeking next Monday. I'm stressing my ass off. That's Shawnee. Shawnee, jy word fine te wees, bro. Hou net jou bek toe en maak seker jy het jou masker en alles aan en hou jouself skoon, man. Dan gaan jy nie moeilikheid hê nie. Polly says, man, let's see. I'll put it up for you guys. The problem is employers are now insisting that staff and contractors get tested if they display any symptoms at all. They won't allow employees and contractors back at work until they have the test results. And now with it being a delay, Paulie, obviously it's even a bigger problem because those guys can't get to work and they can't do the jobs that they need to do at the moment. So obviously we want to get those guys, well, you guys back at work. If you are at work, we want to get you back there as quick as possible.
Are we better?
There we go.
Yes, there we go. We're back again. Sorry,
Okay,
Nick.
good old 3G.
Got
Good old
all
3G.
3G. Wow. Nothing
working.
better in NHC.
There is. I think nothing seems to like me though. What can I do?
Well,
You and the show. You and the show.
We're jinxed. We're jinxed.
we found the one that works. That's brilliant.
Okay. So we were
that's
answering
brilliant.
about that lady's concern about sending her children to school, and I was saying it's about risk benefits, and children don't really get ill, and they're not vectors. They don't make other people really ill. But it's if you've got elderly grandparents living in a small little townhouse with you, you've got to bear that in mind.
Yeah. Okay. Well, Cindy, I hope that answers your question. Next one, Nicky, is from Candace Taylor. She's like, I'm worried about my home help taking a taxi now that the taxis are full. Should I rather ask them not to come or just do extra sanitation when they arrive?
That's a very good question. But giving her extra sanitation when you arrive only addresses what she's got with her on her skin. It's not going to address the virus that's sitting in the respiratory system. And she's potentially then the minute she coughs or she sneezes in the workplace, it's then going to be in her house. I would recommend either trying to organize some kind of limited public form of transport. So I know in my area there are people that are offering transport, but then it's smaller. It's like 3 people or 4 people in a vehicle. And not sitting right next to someone, because that's a concern. You don't want to be sitting. You want to have a bit of spacing. You don't want any physical touch with somebody.
Yeah.
Okay. All right. So, Candace, I hope that answers your question. Next one, Nikki, is from Rowan Jacobs Anderson. If someone who was tested positive for COVID has self-isolated and done everything right, do they have to be retested to check if they are now negative?
This is what I was referring to in terms of responsible testing. The answer to that is definitely no. There's no requirement for a retest. The NICD have absolutely assured us that the virus is not contagious, or you're not infectious, because the virus particles die after 6 weeks. Listen to me, after 2 weeks. But the dead particles are still present and can be tested up to 6 weeks later. So, but it's dead virus, and it's dead after 2 weeks, and for that reason, there's no reason to retest.
All right.
Brilliant. Well,
Good stuff.
next, one thing that I've also heard, and this is also from the international community, is that sunlight actually kills the virus. Lives at night. It's apparently it's a very nocturnal virus. It lives at night, but sunlight literally kills it if you get into direct sunlight with your clothing and stuff. So, is there any truth in that? Can you get that for me?
So there's some benefit from UV exposure, but it's again not going to address everything that's in your respiratory system.
Yeah.
It's not going to kill that. It's going to kill anything that's topical, so anything that you've carried home with you. So
Yeah.
that is why you can wear your mask, and when you come home, if you don't have access to hot water, which sadly some people don't, then at very least wash it, but then put it in the sun and have a rotation of masks.
Okay.
All right. Good stuff. Next one, Nicky. This is from Susan Davis. She sent it to me on WhatsApp. She was scared we missed it on the comment section. She said, just want to know, how do the doctors know who are carriers of the virus? My disabled sister tested positive for COVID, but the only symptom she had was high fever. Does this mean she's a carrier? Does it mean she has COVID?
So anybody with one symptom is considered symptomatic, and that one symptom in her was a fever. So she's not just a carrier. She is infected with the virus, and therefore she's a potential risk to all those that she comes into contact with. In fact, all those that she was in contact with 3 days before the symptoms started, and then for a further 14 days post the onset of symptoms.
Yeah.
Sure. Okay. Wow. Okay. So that's hectic. So what you're saying is, let's say, just for example, we find out Chris had to come to me for something, and then we find out that I had the virus, and Chris goes home. Does that mean he has to then, with the family, self-isolate, and anybody that I got into contact with 3 days prior also, or?
So you would be obliged to report your contact listing, and at the moment the form only says within the day, but really the right way to do it would be anyone that you'd been in contact with 3 days prior to 3 days prior to your onset of symptoms. That those would be your potential contacts. They would have to be informed, and they have to be in quarantine. So they would hate you for it, because you're committing them to being in the naughty corner because they've misbehaved, essentially.
Yeah.
And by misbehaving, it doesn't mean somebody that you've just greeted at your doorway. It means a contact that you have been less than a meter apart from, whether it's inside or outside, for more than 15 minutes without a mask, or anybody that you've shared the same room with for more than 15 minutes without a mask. So the absolute essential item here is, if you're wearing a mask, then that's not a contact, because you haven't had exchange or potential exchange for a respiratory pathogen. But the last one is physical touch. So if you hug that person hello, you have then made them a contact.
Well, that's me.
Do you hug everyone?
I hug everyone. You know, I'd rather die happy. I must be honest.
Are you looking to be sent to quarantine for 14 days? Because here's the thing. So if you then have been in contact with Whitey today, and tomorrow or the following day or the day thereafter he tests positive, there's no point in testing you, because we don't know where at all, if at all, on the continuum of the 14 days that it can take for you to incubate. So we don't test you until you become symptomatic. So, because on average the incubation period is 5 to 6 days, but it can be up to 14 days. So you could only then develop symptoms possibly 2 weeks after having seen him. Then you develop symptoms, then we test you, and then you are self-isolated. There's a difference between the terminology self-isolation and quarantine. When you are sent to home for 14 days because you've been in contact with someone, that is quarantining. But when you yourself are ill, then you've got to self-isolate. You've got to keep yourself in your own little room at home, not share the bathroom with other family members.
Well, Dr.
So
Nix,
no hugging. You can do Ramaphosa's elbow story.
Okay, I'll do that. And even if I have a mask on and stuff, and just and we're sitting
no
in the
hugging.
sun.
That's physical touch.
Oh,
So
shit,
us as
okay.
doctors, and
Yeah.
listen, we are the first people. We want to examine our patients. We want to, but so gloves on, apron on, mask on, and if you're doing any aerosolizing procedures, you've got to have a visor, goggles, or goggles, cap, booties. So we've got to you've got to respect this virus, and you've got to maintain your distance, Chris. I'm sorry to be a stickler.
Well, I will do that then. If it makes you happy
That'll
and it
please me.
saves my life, I will do that.
Thank you.
Sorry, Whitey. What's the most symptoms that you guys have found at the moment? What's the stuff for everybody that's at home now? What's the first things they should go when they get symptoms and they go, well, fuck, maybe this is it. Sorry.
So we always spoke about a fever, but very many patients don't even have a fever. The other thing that a lot of the patients are reporting is anosmia, which means the loss of their sense of smell, and that can take quite a long time to recover. So that's not a pleasant symptom, to lose your sense of smell. Some people lose their sense of taste. A lot of people report just a headache, and some are saying, it just feels like I'm a bit sinusy, and they're laughing that off. But it's enough reason if you're symptomatic and it's a new symptom to go and have it attended to and make sure it's not a coronavirus.
Okay. All right. Well, there you go for that one, Chris. Next one, Nicky, is from Paul van Staden. What are the current risks for anyone becoming reinfected? Does a person's condition worsen each time?
So I think a lot of people feel that because they've had it and that maybe didn't even feel very ill as a result, that they rest on their laurels and think they're going to be fine the next time around. And that doesn't necessarily hold true, because it does depend on the viral load. So the next person they come into contact with might have a much higher viral load and put you at much greater risk of having a more significant illness. The other question was the risk of being reinfected. Sadly, our antibodies haven't been shown to be protective, so there's no reassurance. And even we're starting to see one of the doctors in the group had a patient who diagnosed early March as positive and presented again now. And the question is that still positive testing from the previous infection, which is a bit long for us to believe that to be the case. We are all of the opinion that it's probably a reinfection.
Sure.
But don't you build up any resistance against it? Or
it might only last, the studies seem to suggest it might only last 2 or 3 months. We don't have enough science. Retrospectively, we'll be able to go back and have a much closer look at everything. And until we have the reassurances, it's safer to assume that we're not properly protected.
Yeah. I see a nice question. Maybe you can read. I don't know if you can read that. I know we're having a bit of a problem with the sound and stuff there. Once again, I don't know. We are so jinxed when it comes to you.
I think the virus follows you. No, we had a horrible sound issue coming there from you, Nicky.
It's there again.
I don't know what stack I can put him. I can't even put it. No. We good.
Yeah, you're back. Okay, brilliant.
Better.
You sound like a robot.
Okay. No, I don't know what's going.
That's digital, don't worry.
I don't know. Way to put it that it's not going to make that noise. Is that better?
That is better. You know what? Yeah, if all else fails, we can always just go off and come back on again. I know that works wonders.
No. I can't.
Yeah.
Oh, yeah.
It's grateful.
Next, we're just gonna take you off quickly, and then just go back on the same link, please. So just switch it off and come back on the same link. We'll keep everything rolling.
Yeah, Cindy, I do agree. It looks like it's your question. But Cindy, I know you might have missed it the last time Nicky was on about the visor. The visor is not at all protective at all. It's a secondary protection, because what Nicky told us the last time is that because there's holes everywhere and gaps everywhere, as soon as you breathe or so, and it still comes out. Yeah. And I'm one who also struggles with the mask. It's very difficult to breathe every now and again. And then that's why I try not to go out to the shops at all, because that mask kills me. Now, Nicky already prescribed for me micropore. It's like a type of tape that you put on the mask and on your face, so the air doesn't escape into your glasses, so you can't see anymore. But
Yeah.
I try to be in and out as quickly as humanly possible because I really cannot stand that mask. It does.
Yeah.
I struggle to breathe.
Yeah.
It's because the 3-layer is nice and thick and everything, so you're protected. But now you breathing carbon dioxide back
Dude,
in, half carbon dioxide.
It's
so.
like somebody's got a pillow on your face with all the masks and stuff. The way things are now. See, we're getting her back. Hopefully, everything's gonna work
Right
swell just now. Yes, and we're back.
on the laptop.
And now?
Yeah, we're back on the
you're
laptop.
back
This
next. Now we
computer-
can actually chat to you.
Is this fine?
That's 100%.
It's on the
We'll make it
laptop. Are
work.
we fine?
Yeah. Yeah. Let's see how long this lasts.
No, this is not good. No, it's bad. No, Nicky,
Is that
you
gonna
froze
work?
it solid. No, it's not going to work. You froze it solid, and
Yeah.
there's about
It was better on the phone.
Yeah.
I'm sorry. I'm so sorry.
Don't know what to say.
The coronavirus infected
I'm
our
gonna
computer
disconnect.
systems.
Yeah.
Okay, wait. Wait 1 second. I'm going to disconnect. Okay, 1 sec. I'm going to try. I want to just disconnect.
Daar kom hy nou eers deur.
Ja. That's insane.
Dit was 30 sekondes. As dit
Ja,
nie langer
just
was.
about.
Really?
Yeah. Wel, dude, terwyl ons dit uitsort, kan ons al
Disconnect from-
Ek gaan nou
Ja.
afval.
Haal dit net af.
Yes.
Ek weet jy kan met haar praat en stuff. Kom ons
Ooh,
gaan gou
wow.
hierso. You see hom
Richard.
Donnie man. Die DVV Bible Donnie. Hy sê, "What are the chances of my child getting COVID-19 or staying at home with me smoking?" Want Donnie, rook doen fokol nie. Ekskuus. Smoking won't do anything. It's nothing's proven. Like they say, there's not enough science, and we know smoking does not affect this virus. In fact, according to certain studies, it actually strengthens it. But here in South Africa, it's more a political thing and a power thing and a money thing. So that's why if you're still smoking, enjoy your smoke. Let's see what other people are saying. Belinda, let's see. I'm going to go back here. Is that
Okay, ek
Here we go.
gaan nou terug 3G toe, so hopelik werk
Excellent,
dit nou
man.
weer.
Belinda Walstresser, if you have underlying conditions, diabetes and high blood pressure, would you suggest to complete the risk form and rather work from home?
Okay, let's try again here.
Yeah,
Nicky.
that's something we did
Nicky, you back?
definitely need.
Good gracious.
Yeah,
There you
hello.
go,
Okay,
yes.
that's brilliant again. And you
So
know what?
Chris,
Next,
let's- Yeah.
I'm going to throw you straight into the deep end here so we
Okay.
can catch up
Yes.
on some of these questions. Here we go. Belinda Walstreet, so she says, if you have underlying conditions, diabetes and high blood pressure, would you suggest to complete the risk form and rather work from home?
Belinda, I think that's somewhere where your doctor needs to guide you. If you have hypertension, it does increase your risk, but really it's more the patients who have moderate to severe hypertension. Moderate would be patients with a systolic blood pressure of 160 to 179, and severe would be more than 180 systolic. I think the other question was around, I think, asthma. Am I right, Chris? What was the other
there you
condition
go.
she asked about?
Asthma.
Diabetes.
Yeah.
Okay, so diabetes also is an immune compromised position, but there's diabetics and there's diabetics. There's diabetics who have very poorly controlled glucose levels, and they would be more sensible to work from home. But it's risk. It's again a balancing act between how effective are they working from home and just how much of a risk are they with going back to work.
And asthmatics, are they at greater risk purely because it's a respiratory disease thing?
Yes, and then so in their own right, but the patients with significant asthma obviously are a far greater risk. So the patients who are on inhaled corticosteroids and either in addition to that needing a reliever and still aren't well controlled, and they would know their level of control because they'd know how many hospital admissions they required. They would know how much reliever medication they need, and they could even test their their peak expiratory flow rates with a machine called a Reinfected, which they can get from the pharmacy, and they can see where they are compared to what their best measures have been.
Yeah.
Their general practitioner ought to know what their baseline peak flows are like, and that you can use to compare. And especially because we're in the winter season, now's the time to make sure your asthma is optimized.
Yeah. Well, this guy that asked this question, Chris Delaray, he said, we were taught that masks are almost useless without gloves. And this is the guy, he's a COVID survivor.
Are we there?
Yes, let's see if that works. God, why do we always have so much trouble? Well, Chris Delaray is a COVID survivor. He was literally on the Princess Cruises that pretty much got the whole Australia sick, man. But ek seker sy gaan nou terugkom en vir ons laat weet wat die storie is daar.
Ek probeer nou
die
dink
masks
of daar
are
nie ander maniere is wat ek ook kan help nie.
Ek weet nie, man. Ons sal dit uitfigure. Even as dit nie werk is ek seker ons kan 'n daylight broadcast doen saam met haar, waar sy die mense 'n bietjie meer kan vertel. Cindy, let's see this one, man. The masks are crap. I battle to breathe so bad, and because of that I'm very short with people, and I'm usually I'm also short with people because I'm very short and I'm such a nice person. Yeah.
Sorry, off topic. Do you know that Wednesday's interview with Alfred and Tumbela, you're going to be, for a change, not the shortest person in the interview?
That's amazing. I can't wait.
Chris is tall for a change, guys.
Yeah.
Anyways.
I'm the tall one. He's with me on ook. Hi, Nicola. Well, obviously this one's for Nicky, but kom ons los die
vragies.
Ja, het stuff, maar sy het ons ook ge-educate. So kom ons check, is there any way that the virus will become something of the past, or will there be something that we will have to live with till the vaccine is found? Oom Johan, ek kan vir Oom Johan straight up sê, net van wat ons nou al geleer het op die net en so, the virus is here to stay. Dit gaan nie weg nie. En soos enige verkoue of griep, any flu or stuff like that, it doesn't go away. It just gets stronger. And but our antibodies and the way they're fighting this virus is actually to create almost like a herd immunity, and also to get our bodies used to the virus. That's pretty much what the vaccine will do, and what a normal flu vaccine does. So slowly but surely, like she said, there's some stuff with benefits and some stuff that's not beneficial. I'm sure, you know what, at the moment, the great things are going and the way things are working, that'll definitely work. But it's not going to go away. It's definitely here to stay, man.
Yeah, and it looks like we've hit now the rock bottom. I think she's restarting her phone, or the battery died.
Shame,
and we were doing so well there for a second, and we're getting the guys to on. And I see my buddy Richard, Richard.
Yes,
Richard, you're
Mr. New Hip.
Now, listen, you're a gentleman of age proportion. I don't know. You're an old man. Please look after yourself. If you think you're sick, my personal opinion, get tested, get sorted, please.
Yeah. Plus, Richard was in hospital. He was in hospital recently, and we're very glad that he's made hy's weer terug, hy braai sterk. And Rich, you know what? You were in the one place where it's easy to get it. Just go have a test again, make sure that you're right. I know that you look after yourself.
But make sure you double look after yourself. But here, Paulie has got a brilliant question where I wonder what the doctor's opinion is regarding the statement for a doctor that COVID-19 is a vascular disease and not a respiratory disease.
Well, yes, she's back, man. Let's see. Let's wait for her to get on properly.
Yeah. But let's go through from the top. I think we go from Johan's question. Oh, but you answered it already. Yeah. Nicky, you back?
It's... Oh, man.
I really hope so, but I'm not holding my breath.
Don't worry, neither are we, but we're going to shut up. You can read this question and then answer it. Hopefully we can hear everything you have to say.
Okay. Any luck?
Hopefully we're on the same vibe here already. Let's see. Oh man.
Okay.
Guys, we do apologize for the
Sorry.
very bad technical error.
Yeah.
Yeah, maybe
don't
I must
worry,
maybe I must phone her and put her on speakerphone. Actually, that's maybe a good idea. I've got unlimited airtime. So, Chris, ek gaan my cans moet afhaal, okay?
Okay, cool, man. That's cool. Well, guys,
Okay.
while we're on you,
Are you?
can you hear me now, Nicky?
I'm not sure. You able to hear me?
Nicky, I'm
I
gonna phone you.
can hear you here and there. White is actually gonna call you. We're gonna continue.
So the question is, will the virus become something of the past? Will this be something that we have to live with till the
Yeah.
vaccine is found?
Yeah.
Her phone's off.
No.
Nicky, is your phone on? Your phone.
Okay.
Yeah. Whitey wants to give you a call.
Phone's off. Kan eers
Ja.
dit doen nie.
Oh man, dude.
Ek kan huil.
Ja.
Hoor dat daar kom dit nou eers deur.
Yes.
Ek gaan nou afval. Ek
Ja.
kan nie.
Okay.
Praat
I
met die
wonder what
mense,
the
Ek gaan nou
dude,
bel.
Paulie het nou hierso ook soos wat jy gevra het, is 'n vascular. Dit's 'n baie cool question. Can you not phone her and put it on speaker, Whitey? Cindy, you should be a genius. You really good. Okay, ek kan neem aan Whitey chat nou gou met haar. En hy's besig om haar goeders te vra. Klote. Talks about us going back to level 5 lockdown next week. What's your view, Dr. Nick? Guys, it's shit. That all depends on the doctors have got one thing to do and the politicians are doing another thing. So this is not just a virus thing in our country anymore. It's definitely something that goes both ways. There's a lot of power play and stuff involved with this at the moment. And we're just on the receiving end. We just take it in our stride, man.
But we do have to listen. We have to listen to the doctors and so on. I trust Nicky 100%. She's been a family friend for many, many years of mine. I trust her 100%. Christo is a very good friend of ours. Let's listen to these guys. A lot of people, 90%, I reckon, I'm just guesstimating, are not listening. And that's why everything is now going a bit cockeyed.
Haywire. Well, dude, obviously we can still, you know what, me and you, we kind of stay informed on all this stuff. One thing I've done to try and keep myself sane and to not let the psychological stress screw you up is don't read all the cuck that you read on Facebook and on Twitter and
fake news.
Yeah,
be careful
stop
of
watching
fake
the news. Our news is monitored by a political party. Half the shit you hear is not true. So and it's not factual. So don't listen to all this stuff. Rather see what the trends are doing, what the real stuff is, and what's really happening. Find sources with real answers. Yeah.
Exactly. Like somebody sent me a WhatsApp the other day saying, the cigarettes battle has been won, blah, blah, blah. The cigarettes is being released today. I'm like, I doubt that. Just go do a little bit of homework before you start spreading the rumor, because that just increases the nonsense going around. Let's just, before you think everything is real, people are there to cause trouble and lie and maak moeilikheid.
Straight. Chris, almal nuus op my kop, man. Solank ek net die snot van my ore af was, hoort ek fyn te wees. Dankie oom Johan. Ja. Fucking smeer hom, papi.
Me, Dave, I'd love to get, that's the one I want to get Nicky to answer. I really, but dit was dit nie in Kossazama Glamini Zuma wat gesê het is vascular nou eskielik nie.
Nee. That's part of the stuff that's been coming out where the guys actually in China said it's not a respiratory thing, it's a vascular. Yeah, it's literally your veins clog up. And then,
I want to hear this from her side.
Yeah.
So
we need that.
Dave, I think we're all in the same boat that we want to know the answer to this. I'm really keen. And we will go over time. This is our show.
Yeah, if we need to, we'll do this, man. Let's see. Dr. Rains is a house doctor for years now, and I only trust her opinion. Well, Martin en Celeste Oosthuizen, weet jy wat, ons stem 100% saam met julle, dis hoekom ons met haar chat.
Here we go.
en alles met haar kan uitsort. So, she is back. Ons
Okay,
gaan, we're going to make it happen now.
Must I just put you on loudspeaker on the phone so we can chat to you like this?
Mandy
Okay,
Wiener
so
is my
I'll
only
just second.
go-to for facts. So, guys, you heard it from Cindy Lewis. She said, go to Mandy Wiener. She's the one that'll sort you out with real facts, and I know she does fact-check all this stuff, and she is super factual.
En Chris, daai nommer wat jy my 'n private chat gestuur het, dis die kantoornommer en dis nou 'n voice answering machine wat sê, this is the offices of NHC. Our office hours are from 8 to 5. You cannot
Het
reach
jy
us.
daai nommer vir my gestuur? Ek het hom nie vir jou gestuur nie.
Ek het hom
Dis
nou
wat-
net van jou af gekry.
Nee, dis
O,
Nicky
Dr.
wat hom
Nicky.
al opgesit het. Ja.
Nee, maar daar sien ek, sorry. Nikki's aardappelslaai is lekker, boys.
Ja.
En daar's 'n
That's right.
stytjie wat vir my wag.
Oh, was another doctor that made that statement. You know what, Paul? You're actually absolutely right. But the same with any field. Doctors can be like mechanics, bro. They can look at the same problem differently and find different stuff that's actually wrong. So we'll keep up to that, man. Let's see. Richard, he says, yeah. Thanks, guys. I'm doing very well. Heard of COVID self-test. That one can quickly do at home. Not sure if it's true, though. Here it is. Well,
The next one.
yeah, so Richard, I hope that is true.
No, yeah, there it is. See how long you can hold your breath. If you can't hold your breath for as long as usually can, then you might have it. What do you guys think? Well,
Listen,
that's Nick's answer.
here's a great answer. You've been in lockdown for 3 months. You have not exercised and cooked the way you normally did. Your lung capacity will not be the same.
Yeah,
At
exactly.
all. And I'm talking from a guy I'm a vocalist. I could easily hold my breath for almost 2 minutes. Now it's not the same anymore. I haven't been singing. I haven't been doing any exercise and stuff. My lung capacity is not what it used to be.
Yeah, exactly.
And that as a home test, I'm sure.
And for hang on, Nicky.
But Richard, you know what? Maybe that will work. I'm sure if it's really short, then the symptoms are pretty strong in you. I'm sure not a lot of exercise and stuff like that won't affect you that much. I know it's affected me in small doses, but
Chris,
not yes.
gaan jy vir ons die vraag lees asseblief terwyl ek
Ja.
die mikrofoon hou soos 'n aapie.
Absolutely, man.
Okay, here we go.
Yes. So wait, ek gaan net gou hierso na die eerste
Okay,
vraag.
Chris, can you hear Dr. Reins?
Hi, Nix.
Hello?
Hi, yes, okay, we can hear you now. So now we can actually ask you some questions. This one is from Paul van Staden. He says, I wonder what the doctor's opinion is regarding the statement for a doctor that COVID-19 is a vascular disease and not a respiratory disease.
There's been a lot of talk around that, and there has been, it's a very controversial issue because part of what the virus can do, apart from its respiratory complications, is that it can cause a coagulopathy. And what that means is it causes a clotting cascade throughout the entire body system. And that has deleterious consequences because if you're getting small clots everywhere, you're not going to be able to get oxygen delivered to all of those tissues. So it is one of the tests that we do when a patient is particularly unwell. We test it's a test called a D-dimer, and it helps us determine what their risk of having a coagulopathy is. And in those patients, they get an anticoagulant administered, but there's no evidence that giving aspirin early on in onset, in fact, it suggested that early aspirin can be dangerous to use initially. So it really should only be done after specialist blood tests have been performed and the patient is deemed to be at risk of a clotting abnormality. It's part of what the virus causes, but it's not the only complication.
Yeah. Okay, well, that's amazing news. There's another thing I would like to ask you, Nicky, is Are South African hospitals able to cope with the sudden rise in the numbers now? Because we've been in lockdown for so many months, so that the hospitals and everybody could get ready for the spike. We were expecting this. Do you think this is going to affect or maybe send us back to a level 5 lockdown?
Well, that's where all the drama lies, is that everyone believes that if we had enough time, we would be able to manage. But it's not just about, the point was to try and flatten the curve. We still knew a time would come that we wouldn't be in a position to handle a very significant peak. And that time is really starting now. And it's not as bad as it would have been had we just let everything run its course from the outset. I understand all the implications from business point of view. Your question was, can we cope? Already there's too much strain. Already the hospital beds are full. We are, as GPs, sitting and talking amongst ourselves about how we're going to best manage patients at home when there are no beds for us to send our patients into hospital. Now is not the time to be going and having elective procedures, because you're taking up a bed and you're taking up an opportunity for somebody who needs that care. So it's actually a little bit selfish almost, even if you think you'll get away without falling ill while you're in hospital, which is a silly risk on its own to take. It's not a reasonable thing to do, to be occupying hospital beds.
Yeah. Well, there's a guy here, Quentin Herbs. He says, guys, everything will be fine over there in South Africa. South Africa's 2 months behind us with the COVID. Obviously, he's in the UK. And he says, you know what? After 2 months of hectic stuff, everything seems to be going back to normal and everything seems to be working fine now. Do you think...
It's so good to hear that, and it's so good to have somebody who gives us a ray of light. And it's always nice to have hope. But we also have to recognize that our healthcare system is not comparable to that in the UK, sadly.
Oh yeah. Oh, yes. And tell me, Nicky, has there been any scientific proof that smoking influences it?
Absolutely, because your respiratory system is already compromised. So if that was a personal question, Chris, here's my plea to you. Stop hugging people and stop smoking.
Okay, I'll do my best, I promise.
There was a question posed earlier by somebody with regard to wearing a face visor and whether that is sufficient.
Yes.
It's some kind of protection. We've definitely agreed that that's not I think we even discussed this last time on the show. I think Wakey was saying he was struggling with his glasses fogging up. So the answer primarily still here is that you've got to wear a mask. If you choose to wear a visor over that, that's all well and good. Yeah. And you're going to ask, why is it okay for the children to just wear face visors? Again, it's because they're not significant vectors. They're not big carriers of the virus. So at school, if they're wearing a face visor, and there's already some form of distancing in the classrooms going on anyway. Yeah. But as an adult who can be taught to wear a mask properly, and that's, again, something that we all have a big issue with. People are not wearing their masks properly. I'll get back to that. But wear a mask properly, and if you choose to wear a visor, that's great. It's extra protection, but it's not primary protection.
Yeah. Well, thank you.
So our personal protective equipment involves an apron, gloves, and a mask, first and foremost. So that tells you what we as doctors are supposed to be doing. If you want to emulate that and protect yourself, a face mask is first and foremost. Subsequent to that, if we're going in to do an aerosolizing procedure, then we add a goggles or a visor as added protection. But it's not sufficient as primary protection. And then getting back to what I was going to say about wearing your mask properly, it's the ABC or the AABC. So A is always wear your mask. The other A is avoid touching your mask. B is it's got to cover the bridge of your nose. So not the tip of your nose and not underneath your nose. Yeah. And it's got to come underneath your chin. That's the C. And then those people that complain about their glasses messing up can go to the pharmacy and buy a product called Micropore or Transpore. It's a clear, transparent tape, and that can just be helped. You can tape the mask onto the skin of your face, just under the eyes, and they'll stop that air leakage. And then you can carry on safely, and you've got a mask protecting you, and your glasses aren't going to be fogged.
Thank you, because David Curvelar just said, I hear that rolling up a tissue at the top of the mask, it helps with the stemming up of glasses. So try that.
Yeah, so the micropore works really well.
Yeah. And here we've got another question from Johan Potgieter. He says, hi, Nicola. Is there in any way that the virus will become something of the past, or will it be something that we will have to live with until a vaccine is found?
I'm going to answer that now. I have one quick other point to make about the masks and the leakage of air and the glasses fogging up.
Okay.
Again, it's also finding a good fitting mask. Surgical masks have that little metal strip that you can pinch over the top of the bridge of your nose.
Yeah.
That also helps. Or make sure that the mask that you buy ties right back across the back of your head. You can get little devices that instead of having a clip around your ear, you can have someone knit you a little rectangle with two little buttons, and you can pull your mask up a whole lot tighter across your face. Again, that'll stop the air leakage.
Yeah.
With respect to whether this virus is going to be something in the past, we all certainly hope that that's going to be the case. Herd immunity is not on the cards at the moment because we haven't been shown to have sufficient antibody production post-infection.
Yeah.
So we are going to have to rely on a vaccine, and let's hope our South African teams, because we are a bright bunch, whether they can get it right ahead of everyone else.
Yeah. Okay, well, that's interesting. Thank you, Nick. I see here that Richard asked another question. He said, hi, good to see you again, Nicky. I'm feeling like I might have had COVID already. Is there a reliable antibody test now available? And if I have had it already, can I get it again?
Well, we've answered that. Yes, if you've had it already, you can get it again. There's a bit of a debate raging with the private laboratories in South Africa to do the antibody testing. They are definitely fighting the Department of Health to get that up and running, because that will tell you whether you've had it before, but it doesn't reassure you sufficiently that you're not going to get it again.
Yeah.
So the answer at the moment is no. We don't have any antibody testing available, but it is something being worked on.
Yeah. Well, next, you know what? I think everybody actually wants to know what's the major stuff that we got to look out for, and how can we? Obviously, you've already told us a million times how to protect ourselves, but what's the most important stuff? What can we do to boost our immune systems and try and just stay stronger now?
Make sure you're getting enough rest, some exercise, that you're eating healthily. We know all about the washing the hands and all of that story. But high-dose vitamin C and zinc can be a useful product to purchase over the counter. Vitamin Bs and Ds can also be useful, but one has to be wary of the vitamin Ds because they can be they are fat soluble, so they can become toxic if you take it to excess.
Okay. And us as South Africans tend to take everything to excess.
Excessively, yes.
Oh, yes.
It's worse than maybe even knowing what your vitamin D status is. Rush after your doctor and have a vitamin D test, but it might have been something that they've tested previously and have suggested for you to be on vitamin Ds. If you have defaulted on that treatment, now's the time to resume.
Yeah. Paul is replying to a question he asked you earlier, and he's also got something else here. He says, thanks for that answer, but what happens with a symptomatic person? Oh, sorry, it's written a bit funny. A symptomatic person whose blood starts clotting. Are there different symptoms with blood and obviously?
So those patients may very well become more rapidly short of breath, and that is the time to be getting off to hospital. Patients who have respiratory problems should look at purchasing a machine called a pulse oximeter or an oxygen saturation meter. It's a very easy to use little device that you clip onto the tip of your finger. Your hands need to be warm when you use it. And it will measure your percentage of oxygen on room air. We like it to be above 92. There are simple breathing exercises that you can use. Whitey, you're welcome to use my Facebook page, and I'm happy to share some of the information. They can either message you or message me, and I'll share on those breathing exercises for the public to use. A very simple thing. So pursing your lips and breathing in first and then breathing out, but at twice the normal length of time that it would normally take for you to breathe out, and against pursed lips. What that does is it helps recruit certain parts of your lungs that aren't otherwise staying open and forces them to do so. You can blow up a balloon. That also helps as a breathing against resistance, because that helps to expand the chest. And deep breathing. So take a deep breath in through the nose. At the end of it, hold your breath for 5 seconds, then breathe out through the mouth. Do that 5 times. And then on the 6th breath in, at the end of it, have a strong cough covering your mouth when you do so. And then do that cycle twice. So that also just helps recruit, other areas of your airways that you might not be adequately using.
Brilliant. Well, next, one thing I also want to know is when you walk into a shop and certain places now, and guys have got these thermometers, these laser thermometers and stuff, what's the ideal temperature for a human being? Because obviously I've walked in and used the same machine twice and it was about 10 degrees difference. What's the optimal temperature and stuff you want for that?
I had to laugh when I was tested recently and it was resulted at 32, and I looked at the person and I said, call me a doctor, because I'm hypothermic. I mean, I think it was not something that they grasped. But I said to her, you've got to test it again. 32 is not normal. So 35, 35 and a half, 36 and a half would usually be the normal range. Above 37.2 would be a mildly elevated fever, and above 38 would definitely ring some alarm bells. But the other problem with the screening that they do is they screen the person, they get a reading of 38, and then they just screen another 2 times until they're happy with the reading. They either need to be confident enough that it's a good enough screening test and not let that person in because they had a reading of 38, but that they're going to have a public outcry, or they've got to decide whether their machine is reliable in testing the person. It's not a reliable tool, unfortunately.
Okay, well, that's a great answer. Yes, another question from Cindy Lewis. She says, is there a specific first symptom, or does everybody's first symptom differ?
Oh, absolutely. The symptoms differ across the board. So some people will just have a diarrhea. Some may only have a headache. Some experience just a sore throat or a dry cough. And some lose their sense of smell or taste as the first indication that something's not right.
Yeah. That's brilliant. You know what? I actually think we've pretty much ran through everything, dude.
Okay, there is a question here that I hope he's retyping it, because he's not getting upset that we're not asking it, but I'm not understanding the question, Nicky. Okay. This is Uncle Donnie. He's an old topic.
Yes.
Okay, I smoke, have asthma, and high blood pressure. I have more chances of picking up the virus, and why not in
Why haven't I contracted it yet?
Because he's isolated. He doesn't go anywhere.
Yeah,
So
exactly.
I don't understand the question too well. I know him, Nicky. He doesn't go anywhere. He stays at home. He's a good boy, so that's why he doesn't get sick. Am I right?
So the misbehavior in other people is what's getting them in trouble from this virus. But if he's managing to stay socially isolated, he's certainly making a huge difference to the risk of picking up the virus. He's a huge risk candidate. So you mentioned so I'm assuming he's probably over the age of 60.
Yes.
Has hypertension, he smokes, and I think you said he has asthma.
Yes.
Yeah, you almost.
He's falling apart.
You'd very much like to have him away from. No, he just needs to be well managed. All of those conditions need to be optimized. So his asthma, which might actually be emphysema and not truly be asthma, he needs to be on the right medication so his lungs are optimized before he even risks getting an infection. Yeah. His hypertension needs to be well managed. Can't do anything about his age, unfortunately, but he should absolutely stop smoking.
Yes. Okay, wel oom Daan het dit gehoor, so asseblief hou op rook. We have to speak to. Okay, here I think we're going to take this as the last one for now tonight, Nicky.
Yeah.
Who do we speak to if we know of someone who has walked into the workplace knowing they have the virus? Oh, that's a good question.
Well, I think that is actually something that should be reported to your NICD, because they may not be out of self-isolation. If they have been tested and they have been found to be positive, hopefully the expectation would be that their doctors had the discussion with them to say, your result is positive. In fact, even before the result comes out, if you send a person for testing, they're considered a person under investigation, and they have to already be in self-isolation as though it might be a positive result. Then when the result comes out, and if it's known to be positive, they have to continue to stay in self-isolation for the 14 days from the onset of symptoms. And I think people think, oh, no, it's fine, I'm safe. But it's unreasonable, and it should be a punishable offence. And I know, they arrested doctors who left their province in Limpopo to go home to quarantine when they were tested positive. So if they can arrest doctors for that, I think it should be something that the public likewise could be punished for. It should be a punishable offence.
Okay. I agree with you.
The person to actually ask who to report it to, the group to report it to would be the NICD.
NICD. All right.
And the other thing, Whitey, so even if you test a patient and they come back as negative, if this is strongly suggestive enough of the person having the coronavirus, so if they've lost their sense of smell or a headache, and they even know they've been in contact with someone, and they themselves are surprised when their result comes back negative. This is the sad thing about the testing. There's a third of people who have the virus who will get a result back as a negative result. And that should be a frightening statistic for everybody.
Sure.
There's a high risk of false negatives. That means people are walking on falsely reassured that they have tested negative and think they are good to go. But they could actually still have the virus, and you've got to trust no one. You've got to believe that anybody out there is a risk to you.
Yeah. All right. And here's a question now that Shawnee is asking, but I think you answered this question, because she's asking, is it possible to have contracted the virus without having a temperature? Now, you can contract it without any...
there's different symptoms,
So the patients who tend to present with a positive result without any symptoms, it's curious as to why they were even tested in the first place, because one can't really know whether their sickness was perhaps even 4 weeks ago.
Yeah.
So, but now you've got a result, so you've got to keep them at bay for the next 14 days.
Yeah.
But you could be completely asymptomatic and have a positive test result.
Yeah.
Okay. Now, I think we're gonna. Sorry, I said one more, but 3 more came up. But this is a good one from Troy.
This is from Booty Love, Troy Kevlar.
Oh, hello, Troy.
Yeah. She's asking, tell us about the theories of quinine, or what?
Yeah, quinine. This is what and dinges is this. TB vaccine and higher altitude. Are these factors that may minimize the death rate?
That's a question.
So this has all been postulated as reasons as to why our death rate is not as significant as other countries. The TB vaccine is something that is undergoing trials. They haven't got evidence that the vaccine, in fact, is the reason for our seemingly lower death rate. It's been proposed, but there's not enough reason for us now to go and vaccinate all those people who haven't previously been vaccinated, so the foreigners that have come into the country. And if his other question was regards to the chloroquine, that is also something that is reserved for patients who are admitted to hospital, and then it's part of a treatment regime in hospital for the severely ill. Because there's risk, again, I mentioned benefit risk, there's risk to taking a drug like that. It can cause cardiac irregularities in the heartbeat. So if you don't know what you're doing and you're not able to monitor that person like you can in a hospital, because you've got the machines and the facilities to do so, it's not something that's being used as an outpatient treatment.
Yeah. Well, next, once again, you know what? You've managed to blow our minds and give us real facts. We absolutely love speaking to you, and thank you so much for getting back to us and being our first double whammy interviewee.
Thanks, Chris. Thank you, Whitey.
Nicky, I'm going to send you a picture of what I had to do to make sure you were working now properly with my cell phone and the microphone and everything.
Yeah.
Okay.
And
This is how.
if ever I come back again, you're going to have to come and find out why
Yes.
there's a mismatch between my machine and yours.
You know what? Hopefully, the next time we have a chat, we'll actually be with you.
That would be great.
Yeah.
That
but
would be
wear
awesome.
our hazmat suits and everything. Okay.
Yeah.
Absolutely.
That's
All
a
right.
brilliant idea. We can spend a day with Dr. Nicky, dude.
Yeah. That's a good thing to go and
Yeah.
record properly and do a proper recording. I think we need to set that up. Okay.
Okay, we will do that.
Okay, no problem.
Thanks, Nicky. Have a
But
good
not
night.
in, not in my center, not until the virus has died down.
Got you.
Okay, and I'll stop hugging people and smoke, not smoke. I'll try my best.
Yes, okay, good. I'm glad you're listening. And
Thank you,
stop
Nix.
smoking and stop hugging everybody.
I will do that.
Take
Thank
care,
you,
Nick.
Nix.
Okay. You too. Thanks, guys.
Man,
Bye.
dude, you know what? It's actually a blessing that we can have her on and find out real facts and stuff about what's going on. I know she represents the whole healthcare division, and she
she's just
represents
worried
it so
about
well,
everybody.
man.
Yeah, and I could see a comments, one or two that's a bit. I'm not going to put up on the screen.
Yeah.
There, but yeah, it's look, she's doing it out of the goodness and kindness of her heart to try and look after everybody as much as possible. That's why I'm not going to bring up that message I just saw.
Van Ondani.
And yeah. So, but we she's trying to give us solid advice. We need to look after each other. I know there's stories. And Chris, just to answer your question, Takbo Chris, I think you missed it earlier. That's why I didn't ask it again. She said, you asking, should I send my kids to school now or should I rather wait until maybe level 1? Chris, what she said earlier, because we had that question earlier, she said, it's up to you. It's really up to you. You must take the necessary precautions, obviously, with the children. Try to protect them as much as possible. But in the end of the day, it's your decision. So
Yeah, and it's actually beneficial if they go to school. Look, like they say, kids barely get this sick from this, and they actually, their immune systems really learn to cope quickly with it. So I'm sure they'll build up. If there's any luck with our bodies building up a resistance, it's got to be that, man. It's all our future. Our kids are our future. So now we know it for sure.
yeah, exactly.
And
so
Christo, ek weet jy's nou terug in South Africa. If you guys watched it last time, we spoke to Christo on the ships. He's a COVID survivor and he's back in South Africa. He should be coming out of quarantine real soon. I
think he should be out of quarantine already.
He should be out. So is tyd om te gaan visvang. Ek gaan jou net nie druk nie, maar fok ons moet gaan visvang, bro. Oh, hey, man.
All right, guys. Thank you so much for joining us. This was a very informative show. I'm happy that we could answer a lot of your questions. Once again, apologies for the technical issues we had. But such is life. We carry on. We sold it forward. You saw what I did. I put the cell phone on a tripod.
We did everything, dude. We had it running through a laptop, an iPhone, a laptop, a phone, and fucking. Eventually, we had to do this. So,
yeah, exactly. But
we make it work.
We got to speak to her and everything.
Yeah.
Guys, let's just go through the week. I can't answer you now. Let's just click there. Our lineup for the week, guys. It's another great one, as you can see. So tonight we had Dr. Nicky Reinfected. Tomorrow night we've got Neil Breitenbach from Prime Circle. Yeah. That's going to be lekker proper rock and roll. Wednesday we've got Alfred Shorty in Tumbela.
That dude wat so lekker lag. Hy sê tokke los op fucking ja, Leon Schuster se stuff, dude. Ek kan nie wag om met hom te chatty.
En ek het 'n WhatsApp gekry van Claudia vroeër vandag wat sy sê sy hoop hy lag. Ek gaan hom sê hy moet vir ons so lag.
Hoorie, ons sal hom laat lag. Hy moet uit sy siel uit lag. Ek soek snot op hy ou op sy foon. So lekker moet hy lag hou.
And then Thursday night we're doing a live show where Pieter Kloete is gonna teach us about knife making. This man is a proper knife maker.
Yeah. And now he's a bladesmith.
Yeah.
That's what they are called. They are bladesmiths, and me and Whitey are going to be making our dream knives with this man. We are going to be so blessed, man, to be able to do that. Ek kan nie wag nie, dude. Ek gaan vir my die mooiste jagmes. Ek wil die mooiste jagmes op aarde hê hou.
Yeah, exactly. And then Friday, Guys, Bro Friday, the one that you always love, where you just chat to
Yes.
us and we chat to you, and then we
Yes.
detail afterwards. So, guys, another good lineup. Cindy, it's the NICD. If somebody is messing you around and they've got COVID at work, find the NICD. It
Yeah.
can be, I think Nicky said it can be
Yeah.
a criminal case, can be
It's either
opened.
that or just get a fucking hammer. That should sort out the problem straight away. Problem solved. Just don't breathe in the spatzels and cock, and you'll be 100%. And they can't infect anybody anymore. It's stupid for them to actually do that shit. But guys, you know what? We love you. Look after each other. Love each other. Moenie mekaar fucking drukkies gee nie, behalwe as jy net in jou huis is. En look up, man. We couldn't do this without you guys. We are still going strong. We've reached 6,000 likes and views. And you guys are still here. Thank you so much for all your support. We haven't said that for quite some time, man.
Yeah.
And I can't tell you how much you guys have helped us through. You've kept us sane. And like and subscribe. Like on Facebook. Subscribe on YouTube. Do those things. Please. It's helping us out a lot. We are not making money out of this yet. But with your help, everything will work out brilliantly, man. And we can carry on doing this for you guys. Look after
Awesome.
yourselves. Yeah.
Guys, have a wonderful day. Take care. Have a good night. Cheers.
Well, goodbye, everybody. From SA Bro.